I'm Dr. Jennifer Gaudiani. Thanks for joining me again tonight for another reading from my book, Sick Enough. Tonight we're going to be reading a box from the end of chapter 6 called The Balloon Metaphor and Fear Foods. As a quick aside, all of us have to take care of ourselves right now. The ways that I took care of myself tonight were to have a really peaceful family dinner, a little bit of a hangout time on the couch, and a lovely walk at sunset with my daughter. I'm also wearing my Wonder Woman shirt, which is one of my favorites. So I encourage all of you, to the extent that is within your reach, to take care of yourself in the ways that that is personally meaningful. As ever, I also invite you to cozy in during this book reading with a snack or a meal, and we'll jump into reading time. When patients begin a nutritional rehabilitation process, they can experience a lot of GI distress. This physical symptom, whether it appears as bloating and distension, fullness, nausea, constipation, diarrhea, or some combination of these, can be easily misinterpreted by the eating disorder. It can hasten to say, "See, I told you this wasn't safe. We have to go back to what we were doing before." This is particularly true since many people with anorexia nervosa and other eating disorders are highly focused on and experience body image distortions around the appearance of their stomach. When patients become underweight or have lost weight very quickly, many have the triggering experience of quote-unquote seeing their most recent meal because their stomach sticks out. Their eating disorder brain can interpret this as weight gain and then try to sabotage recovery work. I like to tell the story of the balloon metaphor in this situation. I tell my patient, imagine I blow up a balloon and tie it off, and I put it on the table in front of you. If I drape a thin sheet across the balloon, you'll see every contour. If I toss a thick horse blanket over it, you might see that there's something there, but it would be less evident. For the first time in a while, you currently have digesting food, stool, and gas at various stages through your digestive system. These are the metaphorical air blowing up the balloon of your GI tract. Because you have insufficient fat and muscle, your abdominal wall is lying like a thin sheet over that balloon. Your muscles literally aren't strong enough anymore to hold in the contents of your abdomen. Therefore, you can see every meal. By contrast, I have a nice horse blanket, plenty of fat and muscle. As a result, pretty much no matter what I eat, my belly looks the same. I encourage you to reframe and understand that only people who are malnourished and underweight can quote-unquote see their meal. As you get stronger and more weight restored, this will resolve. For now, understand that this protuberant stomach is a sign of malnutrition, the opposite of what you're fearing. Toward the end of nutritional rehabilitation, another belly-related finding is that patients often feel proportionately thicker around the middle than they were before they became ill, even if their weight is within an appropriate range. Everyone is built differently. Some patients who first became ill during adolescence not only need to recover from their anorexia nervosa, this is at the end of a chapter on anorexia nervosa, sorry for the specification, but then also need to go through adolescence, even in their 20s or 30s. In particular for females, feminization occurs, with development of curves and an adult body habitus that may or may not be welcome. In addition to the redevelopment of an adult body, patients may yet further gain more weight in their abdomen. This is completely normal. Mother Nature's nutritional rainy day fund is stored centrally. After a long famine, the cave person brain will deliberately keep some extra fat stores there in case the person goes through another famine right away. However, within a year of maintaining an appropriate weight, this will redistribute according to the genetic blueprint of what the person's adult body shape and size was always going to look like. This brings us to fear foods. Virtually all patients with eating disorders have a set of foods that are off limits, often called fear foods. I've had countless patients react in shock when I support the meal plan their dietitian has laid out for them. But Dr. G, there are processed foods, dairy, wheat, fats, sugars in this meal plan. Everyone knows those are bad for you, cause cancer, trigger inflammation, will make me gain too much weight. First, I let my patients know that I walk the talk. I eat everything and restrict nothing. Second, I like to ask them, what if I created a meal plan for you that was virtually guaranteed to cause the following issues? Bloating, fullness, nausea, constipation, hair loss, wrinkled skin, fragile bones, a slowed metabolism, anxiety, social isolation, and cardiac damage. They sense what's coming. I tell them, that's the meal plan you're following presently. The one that your eating disorder has told you was safe. Nothing is more dangerous for you than restriction. By contrast, I remind them, everything that their dietitian has recommended is vastly more healthful and scientifically safer. Thank you so much for joining. See you next time.